So if you look at the virtual care model, there's two aspects, well, three. You have your primary nurse that's there that sees the patient hands-on, that's responsible for the care. You have your PCA that's part of the team. You have the provider, and the virtual nurse really sits in between. It sits in between the technology and looking at the medical record and the care team that is right on seeing the patient directly. So, some of the tasks that the virtual nurse is doing is tasks that we know that a primary nurse can delegate to. For example, um, doing a shift report and supporting the nurse, admissions and discharge, care coordinating, reviewing the record to see if there has been any misdocumentation. We also have the nurse helping to support new nurses. So when you have a new nurse that comes into the room and they need support, then you have the nurse that pops in that can be there in the background to help support them. Or they can be the second eyes for a nurse who needs a double check. Or it's like, oh, I need um, help with understanding what's in the record so we can develop patient care and a plan. So that nurse is there 24/7, no matter what. We do understand that today, when our nurses are thinking about leaving the bedside, it is about their environment and all the things they have to do. And so the virtual nurse could be that person that reduces their anxiety, makes their environment um, enough where they can reduce that burden and be there for the patient, because that's what we want to do as nurses. We want to be there for our patients and our families, and not spending a lot of time that's on the phone or in the medical record, but really be able to function and practice at the top of their license. That's what I want to do for my team.